Splenic hematoma scenario. You are a surgical doctor asked to discuss the case of a middle-aged male patient who has sustained fractured ribs and a subcapsular splenic hematoma. Despite being hemodynamically stable, the patient's hemoglobin has fallen from 10 to 9, indicating potential ongoing bleeding. The patient, Mr. Anderson, has expressed a desire to leave the hospital. Your role is to communicate effectively with Mr. Anderson, ensuring he understands the gravity of his condition and the risks associated with leaving against medical advice. Instructions. Introduce yourself as the surgical doctor responsible for Mr. Anderson's care. Use clear and empathetic communication to explain Mr. Anderson's condition and the importance of remaining in the hospital. Address Mr. Anderson's concerns and reasons for wanting to leave, while emphasizing the potential consequences. Ensure Mr. Anderson understands his condition, the risks of leaving, and his responsibilities if he chooses to self-discharge. Provide reassurance, support, and guidance, offering assistance in addressing any practical concerns Mr. Anderson may have. Enter the room and greet Mr. Anderson. Hello, Mr. Anderson. I'm Dr. Smith, one of the surgical doctors. I understand you're considering leaving the hospital, but before you make that decision, I'd like to discuss your case with you. Tell me, Mr. Anderson, what do you know about your diagnosis? Not much, doctor. I'm tired of being here. I want to leave. I completely understand your frustration, Mr. Anderson. However, hospital stays are only recommended when necessary for your health and safety. My wife has a colon cancer, doctor. I need to take care of her. I understand your situation, but your health must come first. We can arrange support for your wife while you focus on recovering. What about my job interview? I understand that the job interview is crucial for you, but your health is paramount. We can explore job opportunities once you're in a stable condition. I'm not convinced, doctor. I want to leave right now, Mr. Anderson. Can you repeat what we've discussed about your condition? Yes, I have splenic hematoma or whatever. You advised me to stay, but I want to leave anyway. As I cannot discharge you medically, you need to sign a legal document acknowledging the risks of leaving against medical advice. Okay, I will sign it. Before you leave, please, if you experience any worsening symptoms, call 999. They may ask you to come to the hospital or may send an ambulance to get you. Summarize the discussion and offer ongoing support. You've decided to self-discharge, understanding the risks involved. If you feel dizzy or weak or experience abdominal pain, or if there is any worsening of your symptoms, you must contact 999 as an emergency or get to the hospital immediately. We're here to support you, and my contact information will be provided to you for any questions or concerns. Thank you for your cooperation.